Hello, everyone. My name is Amy Myers. I'll be tonight's guest speaker. Hope everyone is doing well, and thank you for joining us. Welcome to Prevention Live, brought to you by the Center for Health Innovations Prevention and Community Collaborations Department. Prevention Live is a weekly bilingual series focused on key topics aimed at preventing youth substance use among Southwest New Mexico communities. Thank you all so much for joining us this evening. CHI staff will be working behind the scenes as I share this information with you all tonight. Although I am unable to see your comments and or questions, please feel free to throw them in the chat as a staff member will respond as soon as possible. We encourage communication from you all as this helps us build and better our program. So let's start with the little follow-up. Last week, we discussed locking up prescription painkillers. This week, we will be discussing the importance of talking to youth about substances. We will also provide a few tips and resources. Now, if you all are wondering, I am in the same shoes you all are in. I am a proud mother of two girls aged 9 and 15. So I have faced many of the same challenges you guys have experienced as parents. My main focus is to speak with you and inform you on not only statistics, but real-world suggestions on how to have a better line of communication with your children. So let's get started. Around age 9, children begin thinking alcohol may not be just for adults. By the time they are seniors, almost 70% of high school students will have tried alcohol, and half of them will have taken an illegal drug, and more than 20% will have used a prescription drug for a non-medical person. In Southwest New Mexico, 3 in 10 9th to 12th grade students report that they are currently drinking. Now let's take a minute to let those numbers sink in. When you truly think about it, for those of you with high schoolers before the pandemic hit, how often would you see a group of 10 teenagers just hanging around? Now imagine that with these numbers reported, 3 of those kids have already experienced drinking and are admitting to drinking. It's a little concerning. This is the highest rate for all New Mexico regions. So now, let's talk about alcohol health consequences. Youth who drink are more likely to take part in the things you see listed here, such as use other drugs, for example, marijuana or prescription drugs. They could get bad grades. This is connected to having academic problems and bad and poor school performances. They could suffer injury or death. Keep in mind, unintended injury is the leading cause of death for youth in New Mexico. They are more likely to engage in risky sexual activity. Young people who use alcohol are more likely to be sexually active at earlier ages and to have unprotected sex. They could also make bad choices. Now, I know a lot of us have thought or even voiced with our friends and family, my kid, they always make bad decisions. Well, imagine what drinking would do to their decision making. Drinking can lower inhibitions and increase the chances that children will engage in risky behavior or do something that they will regret when they are sober. They could have physical mental health problems. Young people who drink are more likely to have health issues such as depression and anxiety disorders. So let's move on to our next slide. 3 in 4 youth say their parents are their number one influence in their lives. So we have to remember that you have the power to keep your children safe from alcohol and other drugs. It's up to us. Their number one influence to talk to them and encourage them to talk to us. How do we do that? Well, this next slide is going to help us out. We have 5 conversation goals that help us learn how we should talk to our youth about substances. Show you disapprove of underage drinking and other drug misuse. Remember, as much as we think they are not listening, they truly are. Over 80% of young people ages 10 to 18 say their parents are the leading influence on their decision whether to drink. Send a clear and strong message that you disapprove of underage drinking and use of other drugs. Show you care about your child's health, wellness, and success. Young people are more likely to listen when they know you're on their side. Reinforce why you don't want your child to drink or use other drugs, because you want your child to be happy and safe. The conversation will go a lot better if you're open and you show concern. Show you're a good source of information about alcohol and other drugs. You want your child to make informed decisions about alcohol and other drugs with reliable information about their dangers. You don't want your children to learn about alcohol and other drugs from unreliable resources. Establish yourself as a trustworthy source of information. Okay, so let's go on to conversation goal 4. Show you're paying attention and you'll discourage risky behaviors. Show you're aware of what your child is up to, as young people are more likely to drink or use other drugs if they think no one is listening. Do this in a subtle way, though, without prying into their personal space. You want to keep their confidence. Build your child's skills and strategies for avoiding underage drinking and drug use. Even if you don't think your child wants to try other drugs, peer pressure is a powerful thing. Most children can succumb to peer pressure, whether it be an innocent joke or something more serious, such as alcohol or drug consumption. Remember, children always want to belong to a group and feel accepted. It's up to us to encourage them to want to belong to a positive, strong, and healthy group that is confident in saying no to alcohol and drug use. Having a plan to avoid alcohol and drug use can help children make better choices. Talk with your child about what they would do if faced with a decision about alcohol and drugs, such as texting a code word to a family member or practicing how they'll say no to their friends. Now, I know this sounds like a lot of information, and it sounds a lot easier said than done. The best thing we can do is not stress. We as parents want to keep it low key. Don't worry, you don't have to get everything across in one talk. Plan to have many short talks. These talks can help over a long period of time and can be tailored to your child's age. It is recommended to talk to your youth starting as early as 9 years old. It may seem young, but that is the age where youth begin to start hearing about substances from peers. I personally began talking to my girls about dangerous candies that could be offered to them by strangers at ages earlier than 9. I wanted to start sending positive messages about being confident and saying no to something they did not feel was right, and also feeling comfortable coming to me or another adult about their situation. Now, we have a short 1-minute video for you all to watch. Let's watch and see how this dad put these tips into action.
Oh, hey, bud.
Oh.
Where you headed?
Just gonna hang out.
It's a school night. With Gary and Todd?
Yeah?
Not sure about those two. I've been meaning to ask you. This is tougher than I thought. Is there any drinking going on in this crowd?
No?
I hope not, because alcohol can lead you to say things and do things that you really wish you hadn't. Isn't this what you're supposed to say?
I know.
So if any of your buddies ever pressure you to take a drink, just tell them you promised your dad you wouldn't. I'd do anything to keep you safe.
Okay, I will.
I hope this is working.
I promise. Love you too, Dad.
They really do hear you.
Ryan.
Yeah?
So start the conversation even before they're teenagers.
Good idea.
For tips on what to say, visit underagedrinking.samhsa.gov. A message from the Substance Abuse and Mental Health Services Administration.
Such a great clip to watch and learn from. I would like to tell you all about an app that is available for us parents. The Talk They Hear You mobile app is available to download on your mobile device, your tablet, or your iPad, anything that you have and you use more frequently. It helps you practice bringing up the topic of alcohol and other substances. It helps us parents learn the questions to ask and gives us great ideas for keeping the conversation going. Now I know I have focused on a lot of information today. I hope it has helped you and put some ease to the idea of having such an open and honest line of communication with your children. One thing I do want to say, and I hope it stays with you all for years down the line, Talk They Hear You goes both ways. If you think you're the only one that is scared of your kids or not going to listen, or if your kids even want to talk, you're not. Your kids are just as scared as you are. So with that being said, remember, check in with your kids because when you talk, they hear you. But always remember to take turns. Let them talk and you hear them. I will not take the credit for that statement. I will give all the credit to my 15-year-old daughter who brought that to my attention, that we parents need to listen as much as we expect our children to listen. If you give your children the chance to speak and be heard, it will be a lot easier for them to speak to others when put in a situation where they need to be confident in their no answer. We would like to ask you all to follow these Southern New Mexico prevention programs for more important information to keep your families and loved ones safe. Prevention Live is brought to you by the Center for Health Innovations Prevention and Community Collaborations Program in Doña Ana, Grant, Hidalgo, and Luna counties, and key partners at the Otero County Prescription Drug Overdose Prevention Program and the Club of Sierra County. Our next Prevention Live will be on April 22nd at 7 p.m. Carlos Briano will present medication disposal, everything you need to know. Thank you so much for joining us tonight. We hope to see you all next week, and please remember to share our videos and live dates and time with friends and family. Have a good evening, everyone.